Hi, and welcome to our first Google tour. Today we're going to be talking about Millennial Goal number 6, which is combating HIV virus, AIDS, and other diseases. Now we're going to start here in the U.S. because this is where we live. We're pretty lucky here. We don't have to usually combat with these diseases most of the time. But today we're going to take a look at Kitty Bus and find out why other countries are not so lucky as us. So we're going to go there now. We're going to first go to the capital, which is Tarawa. As we know, it's located in the South Pacific, and here in the capital, over half the population of Kiribati lives, which is about 100,000 people. And as you can see, there's not much room on the island, and so when diseases are contracted here, if they're not stopped quickly, it could spread into a pandemic throughout the island. But what we're going to do first is we're going to take a look at the 2012 Health Service Delivery Profile for Kiribati. Now, a couple of interesting things on here, and we're going to talk about some of the issues on here. So, here in Kiribati, a couple of the main reasons for disease, as we see here, are overcrowding and lack of safe water and sanitation, which impact the health. Some of the higher diseases are respiratory infections, diarrheal diseases, skin diseases, and hepatitis A and B. But what we're going to focus on a little bit today is why there has been such an increase in diabetes and hypertension over the last several decades here in Kiribati. One of the reasons I think these two things have increased so much is because of the diet of the people of Kiribati. One of the main dietary intakes of these people is what's called copra, which, as you can see here, which is the meat of the coconut. They either skin dry this meat or they eat it raw. The reason I feel like this is a big part of this issue is because when consuming 100 grams of copra, you're also consuming 33 grams of fat, which isn't good for anyone's health, as we well know. Now, one solution that I think would be to this problem would be for the United Nations to get in there and to help this nation out. Over 50% of the population lives below the poverty line in Kiribati, and they don't have the money nor the space, as we saw from the image of Tarawa, that to harvest and be sustainable on their own. And so what I think is that the United Nations, taking a global perspective, should move in and help these people with aid and help them as much as they can getting food there, so that they don't have to focus on this copra to be part of their main diet. Now we're going to go back over to our Google tour, and we're going to talk a little bit about how these people manage their disease and control it. So the first thing we're going to go to is the Betio Referral Hospital. There's 4 referral hospitals throughout the islands. 2 here on the capital of Tarawa, 1 in Christmas Island, which is for the Line and Phoenix Island, and 1 in Tabaveo North, which serves for the South Gilbert Islands. And what these centers are hospitals that receive patients from the outer lying and smaller health centers and health clinics, which are staffed by RNs and community nurses. Here, these people are able to control disease and stop it before it starts to get out of hand. And I believe these are a great asset to these islands, and the system works fairly well, as we can see in the report again, that it depends on the type of healthcare or problem that they have is where they go. Thank you for joining me on this Google tour. We'll continue to explore issues from other millennial goals as we move along.